Are you really protected or just waiting for a stroke? We are talking about atrial fibrillation in this video. Atrial fibrillation is just an irregular heartbeat which increases the chances of having a stroke and heart problem as well. This irregular beating increases the risk of forming clot which could travel to brain and can cause stroke. So we are going to discuss about the risk factors and how this can be managed. When we talk about the risk factors, we divide it into two groups. One is non-modifiable and the other one is modifiable. When we talk about the non-modifiable risk factors, it is basically age, genetics, and gender. And when we talk about the modifiable risk factors, the list is long, but main important modifiable risk factors are obesity, excess alcohol, excess caffeine intake. It also includes having any chronic heart problem, diabetes, and smoking. So what sort of symptoms a person needs to look for to suspect whether there is an atrial fibrillation or not? Main symptoms atrial fibrillation gives is palpitations, having a feeling of doom, dizziness, and lightheadedness. So if you're having any of these symptoms, you must speak to your GP. They usually arrange for a heart tracing, which we call ECG. If they don't find out any issues with the heart rhythm, sometimes your GP can also refer for another heart tracing for 24 hours. So what happens when an atrial fibrillation is diagnosed? Usually we start with identifying the risk of having clot, and we discuss about the blood thinning medications. So how do we determine whether or not a patient requires a blood thinning medication? There is a specific calculator that determines what is the risk proportion of the patient. Then we decide if the patient needs to have the blood thinning medications. Because blood thinning medication also increases the risk of bleeding, we also tend to have another scoring system to make sure the patient is not high risk. So it is crucial when we are managing atrial fibrillation and starting on blood thinning medication, we have an appropriate assessment of bleeding risk for that patient as well. So you have the all right to speak to your doctor and have a discussion whether or not you're high risk for bleeding. These bleeding risks are calculated by a specific scoring system by your GP. So it is up to the patient after having the discussions with regards to the chances or the risk of stroke, the chances of having bleed. And so it is kind of a balance between the risk of stroke with the risk of bleeding. And we are talking about major bleeds, for example, a bleed in your gut or bleed through, for example, nose or water. Let me know if you've got any comment. Till the next video, take care.